This Friday, we posted a couple of stories about COVID-19, and we asked y'all for questions about the virus and diabetes in particular. The first one comes from a person living with type 1 diabetes who asked if it's necessary to stockpile any medication, and if so, how much? I'd say while it's difficult to predict the effects of this pandemic on the production and distribution of medical supplies, I've heard of no disruptions so far. But it does make sense to stock up in case you become ill and need to self-quarantine. But I'd also be mindful that hoarding could make it difficult for others to get what they need. So the first thing I would focus on is actually check with your pharmacy or physician to make sure your refills are good for at least 3 months. The second thing I'd recommend is make sure your prescription covers any increased dosing you may need during 6 days. In addition, I'd also advise you to try and create a buffer of all your supplies that lasts for at least 1 month. And I'd order more as soon as you start eating into these reserves. And lastly, don't forget to make sure you have a backup blood glucose meter and test strips that are not expired.